Hi, my name is Dr. Daniel Roney. I want to take this opportunity to welcome you to OrangeCountyThyroid.com. The understanding of the information I'm about to go over is what I would say is absolutely critical for you to get better in regards to your thyroid problem, or your thyroid condition. The symptoms that we typically see, okay, are going to be fatigue and tiredness, sluggishness, okay, some depression. We also see cold hands and feet and poor circulation. Constipation is probably one of the main things that we see on a regular basis in regards to thyroid. We'll see loss of hair, okay, or thinning hair. We'll see weight gain even on a low-calorie diet. We can see brittle and dry skin, etc. So these signs and symptoms that we see are indicative that obviously there's a thyroid problem. Now, what we tend to see in practice is the fact that somebody is on hormone replacement therapy for their thyroid, like Synthroid or levothyroxine or Armour, and they still exhibit these signs or symptoms. Now, some more than others, but at the same time, these patients still exhibit these signs or symptoms. And intuitively, they're asking themselves, if things are right, something's not right. They may have gone to their doctor, and the doctor may have adjusted the medications depending on the labs that come back. And the reality, though, is that you're just not feeling right. That you feel that the thyroid, something's just not totally tuned in there. And what I want you to know, according to, again, latest science and data and research that is out there, that many of you, a high number of you, okay, may not actually have a primary thyroid problem. If you had a primary thyroid problem and were on the hormone replacement therapy like Synthroid or levothyroxine or Armour, then you would feel pretty good overall, okay? The reality, though, is, again, according to the science that's out there, that roughly, again, and I'm quoting specific science and data that's out there, roughly 90+% of you do not have a primary thyroid problem. Many of you have a secondary problem that's causing your thyroid to malfunction. And this is very, very important to know, because if you're taking hormone replacement therapy for a problem, okay, that is not an actual thyroid problem, two negative things. Number one, how can your problem ever get better? Because you're not necessarily, or the healthcare providers that you're going to aren't addressing the cause of your problem. If you have a secondary problem, that needs to be addressed, because if that's addressed, the thyroid theoretically should get better, and most of the time it does, okay? The second downside to taking the hormone replacement therapy, if you truly don't have a primary thyroid problem, is the fact that you could actually burn your thyroid out, and it could be the actual cause of your thyroid problem, or on an ongoing basis, it could contribute to that thyroid problem. Okay? So it's very, very important to understand these things that I just talked about, and also to understand that the training the doctors get in regards to the thyroid is at best minimal. Okay? And that's even the top endocrinologist in the world, if you will, that the training that they get is based on a 50-year-old model of diagnosing and treating the thyroid. The data that we now know in the scientific community is so advanced regarding the thyroid that you can just surmise in 50 years, how could you use a 50-year-old model of diagnosing and treating with all the latest data that's probably come out in the last 50 years? Matter of fact, in the last 10 years, the data is overwhelming, and it changes almost day to day. So that in and of itself is why the diagnosing and treating is the way it is. It's based on a 50-year-old model, and the doctors are trained, and this is important to understand, to really only do two markers, TSH and T4, okay? And those two markers are woefully inadequate in order to determine your true problem, okay? Because 7 other markers must be tested, okay? Things like T4, right, T3, both bound and free forms, so that's 4 markers right there. We need to test reverse T3, free thyroxine index, okay? TBGs need to be tested sometimes, and the antibodies against the thyroid, for the most part, need to be tested as well. And in order to determine, okay, scientifically where your problem is actually coming from, those markers have to be tested. It's not even a question according to science, because you could have a problem with along the chemical pathway. You could have a problem with the pituitary gland. You could have a problem converting T4 to T3. You could have a problem with what they call underconversion or overconversion based on too much binding globulin. You could have a problem at the receptor site, etc. So your problem, okay, for most of you watching this video, is not an actual primary thyroid problem. Your problem lies elsewhere, but unless those labs are tested, you'll never know. And for the most part, they're never tested, okay? The other thing I want you to be aware of is that even if the doctors find or you get them to test those other areas, their training is really onefold. No matter what, they're going to assess or recommend hormone replacement therapy like Synthroid, levothyroxine, or Armour Thyroid. And it is just not going to do the job if you don't have a primary thyroid problem. And again, can't say this enough, most of you do not, okay? So again, important to understand the things that we talked about, the symptoms, okay? If you're on the medication or the replacement therapy and you still have those symptoms, it's a red flag, okay? Understand that the testing and diagnosing is based on a 50-year-old model, okay? Understand that if you do not have a primary thyroid problem but are on the medication, it's never going to fix the problem, okay? And it could burn out your thyroid, all right? So those things we went over. We talked about the different markers that absolutely need to be tested that are rarely, if ever, tested. The other thing I want to just briefly talk about is the #1 cause of thyroid dysfunction in the United States is something called Hashimoto's. Hashimoto's is an autoimmune condition. So that is also not a primary thyroid problem. What happens is your immune system, for many different reasons, which for the intent and purpose of this video we're not going to go into, your immune system starts to attack self-tissue. And with Hashimoto's, the self-tissue that is attacked is your thyroid tissue, okay? So again, most of you, again, according to science, roughly 65-75% or more of you that have been diagnosed with a thyroid problem, okay, have Hashimoto's. Again, most of you, 90+%, don't have a primary thyroid problem. It's something else going on. But of those 90+% of you, roughly 75% have Hashimoto's, according to science. So Hashimoto's is the #1 cause of thyroid problems in the United States. And again, it is not a thyroid problem, it's an immune system problem. And I can promise you, for the most part, in healthcare today, the immune system is never addressed. And that is the core root cause of the thyroid dysfunction. If that immune system is not worked on and treated, then you'll continually have damage to the thyroid. And there are specific protocols out there, very scientifically proven protocols that we implement in our programs. Once we find out what your secondary problem is, we want to help get the body functioning better. We want to help get your, at the cellular level, your cells, more oxygen, more blood supply, more energy production in the form of ATP. We want less inflammation in there. So there are things that have to be done in order to allow your thyroid to function well. Many of you, okay, have other issues as well going on. Now, let me just say this. The thyroid, and I have this listed on the website, the thyroid is responsible for a lot of things, okay? Everything from bone metabolism to estrogen metabolism to liver and gallbladder function, progesterone levels. It's responsible for a myriad of different functions in your body that a lot of you have issues with. So we'll see, as a result of low thyroid, things like osteoporosis because of bone metabolism. We'll see liver and gallbladder problems. We'll see stomach acid issues and digestive problems. And most of you have low stomach acid. regardless of what your doctor may have told you. We'll see hormone imbalances because the thyroid is responsible for metabolizing estrogen. So a lot of you have elevated estrogen levels and lower progesterone levels, okay? And that imbalance is very, very detrimental to your health, and it's one of the main implicating factors in breast cancer, believe it or not. Okay, so again, there's other conditions that you may have going on secondary to thyroid problems, but in addition to those, a lot of you have imbalances in your blood glucose levels. You're either hypoglycemic or insulin resistance or maybe even diabetic. You have things like anemia. You have chronic infection going on. You have autoimmune imbalances. You have leaky gut, foods that are causing immune reactions, etc. So there are common threads other than just the thyroid that are going on in your body that most healthcare providers aren't even considering when it comes to your health of your thyroid. So just in short, to wrap this up, I want to let you know that if your thyroid is malfunctioning, in general, your body is extremely unhealthy at this point, okay? And I don't mean that in a negative or derogatory way, but at a cellular level, the thyroid gland is responsible for so many things that if it's not working well, your health is compromised dramatically. And it's very, very important to understand that, because the quicker we can get that thyroid working better and get your body to function better, okay, and restore its overall function and health, you're going to do a lot better, and a lot of you very quickly, okay? So what I would encourage you to do, what I would encourage you to do is click around the website, get informed. That's the key, because in general healthcare, your doctors are not going to be much help with this, and it just has to do with their training. The other options that you have, you can order a free DVD. It's about 30 minutes long. It's a PowerPoint presentation, and it goes through this information in its entirety from a very scientific standpoint. I can almost guarantee when you get done that DVD, your jaw will be on the floor. It is I get the most reaction from my patients after watching that video than all the other things that we treat in this office. And it is because the science is so overwhelming, and you can compare and contrast what's being done for you and what hasn't been done for you, okay? And it's extremely overwhelming. It's actually sad, because a lot of you have been suffering for a long time and just have been woefully misundertreated. Okay, so you have that option. You also have a 2 free visit option. You can come and see me, and it explains on this website why I do that. But essentially, I have to find out if I can help you or not, and we have to do full evaluations in order to be able to do that. And so you have those 2 options as far as a DVD. Just fill out the form that you see on the right-hand side. The other thing I want to just quickly let you know about is a book by probably the most, I guess, advanced expert in the thyroid gland today. His name is Dr. Datis Karazian, and he wrote a book called Why Do I Still Have Thyroid Symptoms When My Labs Are Normal? And that book I listed just under this video in a paragraph, as well as a website called www.thyroidbook.com. And that will give you more information as to that book and Dr. Karazian. I've trained under Dr. Karazian. As I said, he is the aforementioned expert in the thyroid gland in today's healthcare world. And the references that he has accumulated and the research that he has accumulated is second to none. It's irrefutable. The information that he has, the science that is out there is irrefutable. What you'll learn is that it's just not being applied the way it should be applied. Okay? So nonetheless, you have those options. You can always call us at 714-241-9355. But bottom line is, get informed, because without this information, as you will learn, it's very, very difficult for you to get better. And a lot of you have been suffering for so long, and I see hundreds of you in my office over the last couple of years, so I know what you've been going through. Okay? So good luck to you. I wish you the best, and I'll do anything I can to help you.